Assalamu alaikum. Hello everybody. Today our video is about 4 spondies of spine. Spondylosis, spondylitis, spondylolysis, and spondylolisthesis are the 4 conditions that affect the spine. These may be confusing, but you all need to know the difference between them. Number 1. Spondylolysis or Bars interarticularis defect. Spondylolysis is a term used to describe the anatomic defect or break of the bars interarticularis of the vertebral arch. Spondylolysis is a low back stress fracture commonly seen in sports like gymnastics, cheerleading, wrestling, and also in soccer. Usually occur in the lower lumbar spine, especially in the lumbar 5 vertebrae in about 5% of population. Hyperextension of the spine makes this condition worse. We can easily identify the fracture of bars interarticularis by looking at the X-ray. Unilateral bars defects, spondylolysis, may not demonstrate any degree of slippage. Thus, a patient may have spondylolysis without spondylolisthesis. The defect can be visualized as the collar around the neck of the Scotty dog on conventional oblique views of the lumbar spine. Confirmation can be made through CT scanning. This X-ray shows normal anatomy of bars interarticularis. The neck of the Scotty dog, white arrows, is intact. This is the bony bridge between the superior and inferior articulating facets of the left bars of lumbar 3 vertebra. This X-ray shows spondylolysis. There is a break in the right bars of lumbar 4 vertebra in this patient. The Scotty dog has an apparent collar, which it should not have. The collar is the break in the bars. Number 2. Spondylitis or vertebral inflammation. Spondylitis refers to inflammation of the vertebrae in the spine. It is often associated with autoimmune or inflammatory conditions and can lead to chronic pain, stiffness, and in some cases, structural damage to the spine. The commonest cause of spondylitis is rheumatoid arthritis. Diagnosis is confirmed by clinical examinations, X-ray, CT scan, and serological tests. Ankylosing spondylitis is another cause of spondylitis. It is predominantly found in males. Problem starts with back pain at early age, and gradually it involves other joints. Normally, pain is restricted at the involved area without radiation of pain. Diagnosis is confirmed by typical bamboo spine appearance on plain X-ray. Disease gradually progresses with fusion of spine or other joints. Bamboo spine. Images demonstrating the effects of advanced ankylosing spondylitis on the spine of the neck on the left side and the low back on the right. The spine can become inflexible as disc spaces fuse together, giving a straight, stacked view seen on these X-ray images. Number 3. Spondylosis or vertebral arthritis. Spondylosis is a degenerative changes of the spine. It may involve disc, facet joints of the spine, ligaments, and adjacent structures. It is very common after middle age. There is no direct correlation between these degenerative changes and pain. We frequently find severe degenerative changes in these structures without any pain, but sometimes it is associated with pain. We may utilize different investigations like X-ray, CT, MRI. Number 4. Spondylolisthesis or vertebral slippage. Spondylolysis occurs when a vertebra shifts out of place, typically due to a stress fracture that weakens the bone and compromises its proper positioning. An example of this is the hangman's fracture, slippage of C2 over C3. About 15% of patients with birth defects progress to forward slippage. In pediatric cases, L5 over S1 slippage occur in 90% of instances, while L4 over L5 slippage, usually degenerative, commonly affects adult females. This X-ray of the cervical spine with a hangman's fracture. C2 outlined in red is moved forward with respect to C3 outlined in blue.